with the team from WellCure and from Dr. Prashanti Atluri. We welcome all of you who are here as health seekers to seek a natural solution to overcome your health issues, whether it is obesity or blood pressure, cholesterol, heart disease, and so on and so forth. A little bit about WellCure for those of you who are new to our platform. WellCure is an online health platform designed to meet your holistic health and natural health needs. We offer holistic health education, we offer medical and nutritional consultations, we do health retreats, we have several ebooks which you can find on our website, and then we have a very informative website at belcure.com. We encourage you to go there and see what we have to offer. We have natural health journeys of people who have healed from their so-called chronic health issues and living a life today free of medicines. We have an extensive Q&A database. We have we have hundreds of recipes, all for free healthy recipes. And then we also have a lot of programs listed which you can join, similar to this one, which we are going to conduct soon. And we are a natural health community of more than 4.5 lakh users, and more than 20,000 people have reversed their health conditions, and we call them as well cured. We have conducted more than 150 health programs. So, a wealth of information to be found on our website. Please do visit us on wellcure.com. So, today's agenda, what will you learn today is we are going to understand the root causes of circulatory system diseases, whether it is blood pressure, cholesterol, and heart diseases. And then we all know the allopathic route. I'm sure that you all are here to learn more about what are the alternative methods through which you can heal naturally. Probably you are fed up of taking medicines which are giving you side effects, right? You're gaining weight, probably you are experiencing anxiety or palpitations or dizziness and so many other issues which come up as side effects due to the intake of medicine. So you are here to learn more about the natural method. So we are going to discuss about what is the single cause of all the diseases, whether we call it as cholesterol or blood pressure or heart diseases. Is there a single cause which causes these problems to appear in the body? Then we are going to go into a three-step action plan, that is the solutions which you can start incorporating right from today in order to start healing from the comfort of your home. And then we will also introduce you to our upcoming blood pressure and cholesterol correction program. And of course, we will be also taking up questions from you. So we have a little bit of ground to cover today. So myself, I am Asha Shivram. I am a health coach and a nature cure practitioner. I have been practicing this lifestyle for the past 9+ years, and I have completed my diploma in natural hygiene. So I, along with Dr. Prashanti, we conduct several programs for WellCure. I also do health coaching along with Dr. Prashanti. So I will be your host for this program along with Dr. Prashanti. So Dr. Prashanti Atluri is the expert of today's program. Dr. Prashanti is a cardiovascular disease specialist. She lives in Louisiana in the US and practices there. She has more than 23 years of experience in internal medicine and cardiology. And she is one of those rare doctors who has extensive knowledge and experience on both allopathic treatment and the natural method. And she herself has realized through her practice, her study, and how her own patients are healing through natural healing methods as opposed to medicines. And so she believes that integrating diet and lifestyle correction is the way to attain optimum health. And so she strives to get her patients off medicines. So we are indeed lucky to have her on today's program. So she was driving. I don't know if she has joined yet. So Ashleka, is Dr. Prashanti here?
Yes, she is here.
Okay. So meanwhile, all of you can, write on the chat, what are you looking for? Why did you join today's session? Are you looking for some solutions to any specific health issue? So you can write on the chat. Welcome, Dr. Prashanti.
Yeah, hi Asha, and hello everybody. So yeah, is this when is Navratri or what is going on? I don't follow much of festival calendars.
It's already
So
underway. It's already underway, and I think Saturday is the last day.
Saturday is the last day. Okay, I see. So I mean, I'm so glad people are already here, trying to learn about despite of having Dasara and then Diwali. When is Diwali? October or November?
October 31st.
October 31st. Okay. So yeah, despite of all that, people are wanting to know more about health and all that. So how do you guys know WellCure? And have you ever been to any of our programs? Have you checked out our website? Have you checked out all our testimonials? And what brings you here? Who sent this link to you? Like, how did you find out about WellCure? We've been here in business, serving health seekers for quite some time. We've been really doing a fantastic job. If you look at all our testimonials and the amount of programs that we conduct, we are a system where we do not supply any kind of misinformation. We only give you all the pieces of missing information in order for you to understand what is about health, what is about diet, how do we take care of all these issues just by lifestyle adjustments and not drugging, overdosing, and all kinds of side effects that we experience once we get in the cycle of medication after medication. So yeah, let's get started. Welcome to WellCure. If you're first time seekers here, I myself am a cardiologist and Asha is an excellent health coach. So we've been conducting these programs for a long period of time. So yeah, welcome to WellCure family. Let me just read out what you have put in here. Ravindran is asking, is really cholesterol cause of heart attack? Yeah, that we're going to find out about more and more. This is a great question, and we're going to answer this during the program. Vilas is saying, I have sugar with an A1C of 7.7, triglycerides of 272. How to reduce triglycerides? Yes, yes, yes. You can reduce triglycerides through WellCure programs. So Comedy is saying on and off high blood pressure, not taking any medicines. What is the cause and the cure? Well, how old are you? The cause and the cure lies within you. It is your body that is the one that is going to create these messages in the form of high and low blood pressure whenever the body is in discomfort, and the cure is also within you. Satya is saying I have very high triglycerides of 500. Yes, if you have very high triglycerides of 500, then you have to work on diet and lifestyle. No medication is going to fix you. Only the thing that the medication is going to do is it's going to suppress and it is going to cause liver issues. So never ever take any kind of medications for triglycerides. So Anuj is also having high triglyceride issues. Those with high triglyceride issues, you have to work on yourself. Okay. Next one is high blood pressure. I want to reduce blood pressure after taking medicines. My blood pressure is 135 over 78. Yeah, but how long are you going to take medication? So we'll talk more about all your issues. It's all about high blood pressure and cholesterol and general basic discussion. Okay. 1 second, Asha, 1 second. Just chat with them for a second. I have to answer something here ASAP. So guys, please keep posting. I'm coming. Okay, so yeah, so how old are you guys? You sound very young. I don't know why, just based on your names. So how old are you guys? I just want to know because more and more younger population are coming to us because young population are like, no, 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 I'm only 30, I'm only 40. Why am I taking these medications? Why do I have these issues? I need to find out what to do more about it. So that's where their wake up calls are coming from because I don't want to be taking the same drug as my dad is taking, as my mom is taking. Why am I taking the same medication? Why I'm only 30? They're telling me that I have to take these medications forever. So these are the wake up calls that are bringing all these youngsters to understand more about health, more about diet, more about lifestyle. And here we are trying to figure out what to do with it. So next slide. is the next slide here? I'm just saying Valcure here. So, Ravi Kumar is saying I took tablets and then my blood pressure is 140. Yeah, tablets are not going to fix your blood pressure. When statin is recommended by doctor, there is no need for statin if you really follow proper diet and lifestyle. Then Suresh is saying, I am 46, undergone angioplasty last week. I'm on high dose statins. I want to keep my atherosclerosis under control. Arey, why are you only 46? You're my age. And why have you undergone angioplasty and all these things? So you have to work on all these things. This is very dangerous what you guys are doing to yourself with all these medications and all. So prevalence of high blood pressure in India, so it is going up. High blood pressure, cholesterol issues keep going up all the time. One by one, one by one, one by one, people are waking up. But why is it happening? Why is it happening? Why? This is like, rural population, urban population, more and more younger population. You guys will be surprised. We have people coming from cities like Bombay, metros like Bombay, where a third grader or a fourth grader also has high blood pressure issues, and the parents are lost and they want to know more about these high blood pressure issues. So so these are the things that you guys need to find out more. But more and more, like, you guys are already seeing, like, I'm pretty sure people around you already had a bypass surgery, always had a heart attack, and they were always like consistently taking their medications. So how come? Yeah, but the medications are not like, if you're taking medications, then you shouldn't be getting into complications. This is an urgency. You guys cannot blindly pop in these medications thinking that things are going to be addressed by a medication or a pill. It is very dangerous to do so. You guys have to correct the root causes of these issues, which is nothing but what you're eating and how you're living. But let's analyze the causes. Why are you all so young? And then why do you have this high blood pressure? Why do you have these diabetes issues or cholesterol issues, right? So let's just have like true understanding of what this disease is all about, and then we can figure out what to do. Next slide, Ashlika or Asha. So the question to you guys is cholesterol harmful for the body? Is this true or false? So is the cholesterol villain of our life, or is it just an innocent bystander? So Yashodhara is saying, yes, it is harmful. Anuj is saying it's false. So we're going to find out more about cholesterol today, a real understanding of cholesterol. There is no fear mongering over here regarding cholesterol when we are talking about cholesterol. So cholesterol, for your sake, I'm going to tell you, it's not harmful. It is unfortunately made the villain of the story. It's actually very much needed by the body. So there is something that we are doing to the body where the cholesterol numbers, the triglyceride numbers, all these numbers are off, and we have to understand how to fix them at the root of the issue and not keep chasing the cholesterol with more harmful drugs that are going to create trouble to your muscles, trouble to your liver, and in the long run, you are going to lose your memory. So do not poison yourself with more and more harmful drugs, but understand the root of the issue and fix it well. Next slide. So is there any pill that can cure high blood pressure or cholesterol? So here cure means you're going to answer this question today, okay? Is there any pill? So there will be like one pill, okay? You're going to be taking for 10 days and then the problem is going to be fixed overnight. So is there any pill for high blood pressure? If you're going to start once, you can leave. I don't know what you're talking about, but so yeah, but there is a pill that you're going to be taking one time only, or a couple of days, and then it is going to totally address your high blood pressure and cholesterol, or you have to be committed to be taking them for life. So what is the answer? You have to control. You have, yeah. So there is nothing like that. And then the pile up of all the side effects keep happening. I'll tell you more about the side effects and all of it. But it's so easy, guys. It's so easy if you can, address it at the root of the issue and not not intoxicate yourself with these drugs. We will explain more. Next slide. So, what are the causes of high blood pressure? So, why do you think all these 30-year-old youngsters are coming to us with blood pressure issues, right? More and more youngsters are coming to us with high blood pressure issues. So, why? Causes of high blood pressure, causes of cholesterol. What are we planning on doing at this point, right? So more and more of the Squiggy orders. How many of you have a habit of ordering food from Squiggy, no matter what time it is, late night eating, not sleeping on time, always constantly working, lack of nature, lot of stress in life, history of smoking, and then no amount of exercise, but pretty much, desk job as well as just watching, consuming media after media. So, how many of us have that kind of a lifestyle? So, are you guys telling me that you've been eating very healthy, lots of fresh foods, lots of activity, lot of nature time, and then still you ended up with high blood pressure and cholesterol? So Lovely is saying, have gone through angioplasty and stent. Can my husband reverse his blood pressure and cholesterol? Yes, 100%. See, just because he had an angioplasty and stent, that doesn't mean that it is going to stop the progression of more and more disease. So whatever that created the problem is still persisting in his issue. The root cause of his issues were his diet and lifestyle, and he has to fix them. So Abhijit is saying he is doing all these things, it seems. He's doing all these things. He's taking good care of himself, but he still has these issues. So I think some more troubleshooting needs to be done for his issues. Next slide. So blood pressure, cholesterol, and heart disease are inevitable. Do you really believe in it? So people are going to say, listen, you have high blood pressure, you have heart disease, you have high cholesterol. This is all because of genetics. There is nothing you can do. This is all process of aging. You just have to take your medications, just like how everybody is doing. Why are you fighting it? And it becomes, yes, it becomes uncontrollable sometimes. Sometimes you will be on one drug initially when you start off with, and then we are going to add up multiple drugs. And then it becomes untreatable. Then we have to do an angiogram, angioplasty, and then we have to manage with all these ways and can only be managed but cannot be reversed. It is very tough to reverse. You know what? Diet and lifestyle, it really sounds very interesting. But the thing is, you cannot. These things are like deep down in you. And then you have to be committed to taking lifelong medications. So this is what you keep hearing. You go to all these big name doctors, white coats with high blood, with 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 big degrees behind their name, and then they're just going to give you more and more medication. But the thing is, yeah. So what is wrong with continuously taking medications? I'm going to ask you. So why don't you just take medications? Just take these medicines. Just take the damn medicine. One pill, two pills for your blood pressure, three pills for the cholesterol, two more pills for diabetes, one more pill for thyroid. Just let's take them because they're making going to make our numbers look very pretty, right? Blood pressure is going to look very pretty. Then fasting lipid profiles are going to look pretty. Why? Why are we going to know? Why are we here talking about diet and lifestyle? And why are we talking about all these drugs right now? So we need to find out why. What is the harm in all continuously taking popping pills? Then only you will be able to address it at the root of the issue. Next slide. So how, just pause for a single, just pause for a second. How were you guys diagnosed with a high blood pressure and cholesterol? Is it just because the company was doing every year physicals for your health insurance, or did you guys have any symptoms? Were you having headache, palpitations, gases in the tummy, flushing, runny nose, or dizziness? You just can't wake up. And then there is lot of chest pain. Then there is blurred vision. Then you're having shortness of breath. You can't even walk for 10 feet. And then you just get severe shortness of breath. Then there is lot of fatigue. You feel drained out. And then you're seeing blood in the urine, as well as pounding heart racing fast. Yeah. So So then Amit is saying people were getting done. So I just went and in order to check. And then you found out that you have high blood pressure and a cholesterol issue. Kavita was saying, she's saying she has been having headache and dizziness. Saroj is saying she has no signs and symptoms. Then why did you even check yourself? Kamadi is saying she's been having symptoms, nausea, headache, dizziness. Anu, headache. So yeah, so there is one thing or the other. What about indigestion? What about acidity? What about, gases, bloating, belching? Do you have any of them? What about palpitations? Like heart is constantly racing. It's like anxiety after anxiety. You're like, I don't know why. I don't have any stress in my life, but still I'm feeling so anxious. We have solutions for you. We have solutions for you, but you need to slowly tune into yourself. So, headaches, giddiness, indigestion, anxiety, Galaxy is saying that. So, next slide. So, do you listen to your body? What signals are you like? See, blood pressure, high palpitations, dizziness, shortness of breath. All these are signals from your body. Okay, these are signals from your body giving before, like all these are, there is something wrong. There is something wrong. That's when the body is going to tell you that there is something wrong with the diet. There is something wrong with what you're doing to me. That's the reason why my blood pressure is going up. So, what about any gut issues, guys? Let's just talk about gut issues for a second. What kind of gut issues are you facing? Next slide. So, are you feeling cold hand and feet? Are you having mental confusion, anxiety, angry, temper all the time, heartburn? And then what about indigestion? No matter what you eat, it's just sitting there like a rock. You cannot digest it. You feel very bloated. There is a lot of burps that are happening. And then headache, indigestion, constipation, palpitations, breathlessness, dizziness, waking up at midnight with heart pounding. So these are all signs and symptoms that there is something wrong that is internally that is going on with you. So when you go to a doctor, what they will do, they will give you one drug for dizziness, one drug for palpitations, one drug for indigestion, one drug for heartburn. Then you happily come home and then you start popping all these pills. Are they helping you? Is any of this pill helping you? No. The thing is like they just make you so sedated, so nauseated. So the symptoms, the side effects that you are experiencing are going to put your regular symptoms to shame. And at one point, you have to make a choice whether to tolerate the side effects of the drugs or whether to tolerate the symptoms of what is going on inside your body. But if you really paid attention to your body, if you really took good understanding and good care of what is happening to you, then you do not have to get into this vicious cycle of symptoms and side effects, symptom suppression or side effects of the drug. So you have to weigh all these things. So I'm telling you, it is very, very easy and simple. And you are you are part of the WellCure family now. And you have no idea, like thousands of patients are getting the benefits of just by adjusting their diet and lifestyle. They are coming out of this vicious cycle, or what you call as the torture cycle of what do you call torture of like symptom suppression and side effects, symptom suppression and side effects. So we have to make a decision. It's not only about symptom suppression and side effects. I will explain to you how complications occur. So next slide. So how does a heart attack occur? Heart attack is nothing but a blood flow to the heart has been severely reduced. So all this cheesy material, are you seeing that? That is fat buildup, that is cholesterol buildup. But don't you want to know how this cheesy material is built up? Whenever we are eating the wrong kind of diet and whenever we are living the wrong lifestyle, then the body has to build up all this fat, and all of these things are built up because of that, and then it will slowly, little by little, gets added up, and it blocks the blood flow to the blood vessels and causing heart attacks. I'm going to talk to you more about cholesterol. Just give me 1 second. But you guys are seeing a lot of heart attacks, right? What do you think is causing all this trouble? 30-year-old having a heart attack in the gym, 20-year-old, even school children. That you're seeing in the news, right? That even the school children are having lot of issues. There, some of them are like, there is sudden cardiac death that is even observed in schools also these days. It's really sad what has happened. Yes, injecting ourselves with poisons is going to create more trouble. But in addition to that, yes, I agree. This is injections with poison. It's poisonous material that has resulted in all this. But again, I'm going to tell you, in addition to that, people are like, the lives that people are living with lot of stress, with eating wrong kind of diet is already it's already has already started the process. And on top of it, when we inject ourselves with drugs, like inject ourselves with all these unknown substances into the body, that has exponentially put a lot of burden on the system. You have no idea what people are eating. The oil industry is tainted. Everything that people are eating, anything that you guys are eating out, or even the cooked food at home, the way if it is cooked, we're going to teach you more about all these things during the course. But it is really it is hurting us, it is harming us. Look at all these young 20, 30, 40-year-old people who are just dying in the elevators, who are dropping, like, they're just dropping like flies. It's so unfortunate what is happening at this point. It is really, really terrible. So we have to work on ourselves gradually. We have to change the way we are living at this point. Otherwise, there is no amount of drug that is going to save us from this tsunami of what is happening. Look at all of you. You are in your 20s, you're in your 30s. Why do you have triglyceride issues? How do you have all these triglyceride issues? How do you have all these cholesterol issues? You should not be having any of these cholesterol, triglycerides. Maybe in when you are in your 80 or when you are in your 90, then maybe slowly small things are going to build up because of everything. But again, you guys have to work on yourself, and we are coming up with solutions. But let me just explain to you a little bit more about cholesterol and blood pressure so that you guys are not going to live in the fear of high blood pressure and cholesterol. So Sonal is saying her dad passed away due to heart issue. He never drank alcohol, didn't smoke. Even he used to never eat outside. After that, cardio tests were done due to stress. I got my cholesterol high. I'm just 26. Even my mom get high cholesterol. There is lot of stress that is running in your family. By the way, Sonal, how old is your father? Did you mention that? How old is your father? I mean, you guys yourself are very young. Oh my God, 57? And he just had a heart attack just like that, sitting at home? Or what happened? This is just shocking. 57-year-old having a heart attack. You guys have to wake up and really look at the reality of what is going on. It's a collective, it's a collectively, whatever we do as a community is going to save us. And that's what we are trying to do at WellCure. Collective community health building is what we are doing at WellCure. So next slide. So persistent high blood pressure. So what is wrong with high blood pressure, right? So you keep popping all these pills, but the thing is the underlying issue remains the same. High blood pressure is a cause of concern because it damages every important organ in the body. It causes kidney issues. It causes brain issues, strokes in the brain, dementia. It causes heart attacks. It causes heart failure. It causes eye issues and long-term blindness. So you name it, it is going to affect the blood vessels. Because remember, blood vessels are one of the important organ, channels that take important nutrients and blood to all the important organs of the body. So we cannot compromise the health of our blood vessels. So this is what happens with high blood pressure issue. So blood pressure is something that you cannot neglect and that you cannot keep suppressing it with a medication, because the deep down underlying organ damage is going to keep happening no matter how aggressively you control with drugs. Drugs are never the answer for high blood pressure and cholesterol. You cannot suppress them. You cannot make them look pretty, but you have to work on the root of the issues. So am I making you guys have to wake up to this. I have no idea how else to educate you. But blindly popping a medication is not going to help you in any way. So you said, Mary, could you explain that? So then have you tried any of these? So a lot of people are going to say, Are Baba, I'm not going to take any allopathic medicines. I'm going to take protein powders. I'm going to take garlic supplements. I'm going to take apple cider vinegar. Again, all of these are just masking the symptoms, and you're artificially bringing down the numbers, and you are not fixing it at the root of the issue. We are going to talk more about the root of the issue, but do not fall for these gimmicks. The root causes of all these issues were your stress, your diet, your lifestyle, not sleeping on time. All these things are the root of the issues that have created the problem of high blood pressure and cholesterol. If you're not going to address your sleeping, not sleeping on time, if you're not going to address your diet, if you're not going to address your lifestyle, but you're going to just pop in all this garlic, then popping on all this apple cider vinegar, then it is not going to keep you going. It's not going to keep you going. All of these herbs and everything are going to create other trouble in the system, but not address by not addressing the root of the issues. So next slide. So let's say, today you're going to, I don't know how much money you guys have been spending, but on an average, a person with high blood pressure and then high cholesterol is about to spend 1.5 lakhs per year. And imagine if they have complications of high blood pressure and all these things in a 5 year span. If they had an angioplasty, if they had a heart attack, if they are having kidney issues, then it is going to take up to 9 to 10 lakhs rupees approximately. By the way, is there anybody who is having chronic kidney conditions, chronic kidney issues? Is there anybody with CKD, chronic kidney issues, where the creatinine has gone up? Even for you also, this program is going to work very well. You have to work on those diet and lifestyle. Otherwise, the kidneys are not going to like the issue. So, yeah, next slide. Okay, move the slide, please. So then high cholesterol. So what is wrong with popping in high cholesterol medications? There are many, many high cholesterol medications. So I'm going to tell you one little story before I warn you about high cholesterol medication. There is no data in order to support that high cholesterol is going to cause heart attacks or any complications. Okay, that's number one. There is no data. They have cooked up all the numbers and all. There is a very good book written by one of the doctors from the UK. His book name is Statin Nation. You guys can look up Statin Nation, and he has many talks too. But you guys need to stop worrying about cholesterol. Cholesterol medications, on the other hand, will cause lot of brain issues like memory issues. It's going to cause muscle aches, liver issues, and muscle breakdown, severe weakness, and majority of these side effects are irreversible. Once you have it, you have to suffer for life. So I am going to tell you one little thing. My father-in-law, he just passed away in June. He was in his 80s, okay? So in 1990s, he had a heart attack. So every other family member of his sisters and brothers, they live in the US. So back then, in the US, statins were very popular drug. So they used to bring all these cholesterol medications and everything from the US, and he started using them from the 90s onwards. In 2010, he started having a decline in his memory, and then in 5 years he became very much in vegetative state to a point that he was not even able to recognize us. So he has led a poor quality life for the next 5 to 10 years just because of the side effects of cholesterol medications. Statins are a terrible drug. Statins cause lot of side effects, and I'm telling you, my father-in-law had an excellent memory. He never even needed a phone book. he could memorize almost 50 phone numbers without the need for a phone book. And he would just bring the phone numbers, house addresses, which way to go, everything. He had such a sharp memory. And I have seen it decline gradually right in front of my eyes. So do not blindly pop in this medication. Cholesterol was never the villain of our heart disease or anything. It was unfortunately made a villain. So, yeah, don't worry about cholesterol, but it is your diet and the lifestyle that are the ones that created these issues in the system, and you have to work on the root cause of these issues. So, I am going to speak up against cholesterol medicines. You guys can keep pop, you can pop, you can do what you want to do in the fear, but it is terrible. It is terrible. Do not do this to yourself. So, yeah, next slide. So don't take it. You guys are only in your 30s, in your 40s. What are you guys doing to yourself? It is terrible what you're doing. So today we are going to talk about the principles of natural health we follow at WellCure. This science is about health building science. This is a natural health philosophy. It's the oldest of all. Forget about Ayurveda, forget about Homeo. We don't talk about Ayurveda, we don't talk about Homeo. This is called nature cure. It's an observational health science. It is not about sickness. It is about health building. You guys have to remember, health and disease do not exist in the same body. As you build up health, you are going to bring down sickness automatically, because health and disease do not live in the same body. You are going to be living in harmony with nature's seasons, the resources, and the wonderful wisdom of nature, as well as your body cycle. It is a drugless system in order to restore optimum mind and body health. Nature herself is the best physician. There is no other power higher than nature that is going to bring about the cure. Remember, you guys want to cure. The healing power is within you. All you have to do is stop this assault on the body in the name of errors in diet and lifestyle. In order to understand what errors you're making, you have to understand how you have to correct your diet and lifestyle. And it is very simple. It is very simple. All we have to know is what to eat, how to cook, how to plate, and how to live well. And automatically, your blood pressure and your cholesterol is going to get corrected. Next slide. So we're going to talk about nature cures. Nature, it's all about toxins, toxins, toxins. What you do not eliminate, what you do not clean up is the one that is going to create this high blood pressure, this cholesterol issues and everything. Our body is self-correcting, self-maintaining, self-healing, okay? You do not need to supply any other chemical concoctions or anything from external sources. All you have to do is you are going to remove yourself from toxic environment, and you're going to keep yourself in cleaner environment. When you give the right inputs to the body is going to heal itself. So remember, the cut on the hand, the cut on the finger, how does it heal? It heals all by itself because this self-healing is built up within the body. The same thing, this high blood pressure, this cholesterol are nothing but whenever there is lot of toxic load, whenever there is lot of toxemia in the system, then your body is going to show it as high blood pressure, high cholesterol. Next slide. So root causes of high cholesterol is nothing but whenever there is lot of toxicity in the system, whenever there is lot of acidity in the system, then what happens is the body there are acids everywhere. So the body secretes lot of base in the name of cholesterol in order to neutralize it. So whenever there is lot of inflammation or whenever there is lot of toxicity in the system, then the body has to produce this cholesterol. So cholesterol is produced by your body in order to neutralize all these toxins and acids, as well as it comes from the animal products that you're consuming, because it's the liver that makes cholesterol. No plants have cholesterol in them because there is no liver in them. So dietary sources of cholesterol coming from high fat meals, when the meals are filled up with toxic material, as well as there is a lot of animal products. So they get deposited along the walls of the arteries and vessels, creating more and more clogging up of the system. So cholesterol is not the villain, but it's the inflammation. It's the inflammation. It's the toxicity. Remember this word. Again and again, people get scared about cholesterol, but the most important thing you have to worry right now is about inflammation in the body. How does this inflammation start in the body, or toxicity or toxemia start in the body? It is going to start from whatever we are putting in the body. Whenever the body is not in an environment that is feasible to it, then we call it as inflammation, toxicity, or acidity, acidemia, toxemia. These are the names that we use. So your body produces cholesterol as in response to what is going on inside it. So don't worry about cholesterol. You have to worry about inflammation in the body, acidemia in the body, and toxemia in the body. So Anuradha, are you able to understand my high school subject that I'm talking about? Yes, you're right. We have to teach it even in the high school also. This is the same thing we have to teach in high school. Otherwise, people are like, the right kind of health needs to be taught from the high school onwards. Otherwise, people are just going to be like this only, worrying about cholesterol, popping in pills, blindly poisoning themselves, living in fear about when is the next heart attack going to happen. Do not live in fear. You have to work on yourself in order to address the root causes of these issues rather than worrying like a high schooler about each and everything. Next slide. So, root causes of hypertension. See, I'm going to give you a beautiful example right now. Okay. So, when the river, for example, let's see how many rivers, like when the river starts off in the mountain. Okay. So, how does it look like? It is very pristine, it is very clean, it's very clear. There is nothing, no plastic, no chemicals, nothing. But now the river enters into the city. Then, what is it going to be loaded with? It is going to it's going to be loaded with lot of plastic, lot of pesticide, lot of chemicals and everything. Then how is the river going to flow? The river becomes very sludgy. It is become very toxic. It is not going to flow well. The same thing, the river sinners are in the body are polluted with lot of toxic material, with lots of unhealthy lifestyle, and it is loaded with lot of toxic overload that results in sluggishness of blood flow. Whenever the body says, oh my God, the blood is not flowing well, then the body raises the pressure. Remember, when the water hose is not running too well, what do? You put pressure at the mouth of the water hose in order to increase the pressure. The same thing, when the blood becomes very sludgy with lot of toxic material, acidic material, then it really creates such a slow flow. Your body is the one that is raising the blood pressure in order to make sure every organ in the body is going to get all this blood flow. Then what do you do with the blood pressure medicine? You're going to lower it. Then the body is going to say, Array, I am the one who is trying to raise this blood pressure because the kidney is not getting perfused. Your brain is not getting perfused because your blood has become so thick, so toxic. So what do you want me to do? You are the one who is controlling it. Then, so you pop in these pills, you check your blood pressure. Oh my God, I'm taking Telma and my blood pressure is showing 120 over 80. I am doing so well. I am doing so well. But then the kidneys are suffering, the brain is suffering, all the important organs are suffering. That's why. That's why you have it. So when you are diagnosed with high blood pressure, what happens? You go to your general practitioner, he gives you one medication. You keep popping the medicine. For a while, it gets better. And then afterwards, the doctor is going to say, Array, now your kidneys are affected. But then, doctor, I've been taking the same medication. My blood pressure is doing well. Why is my kidney affected? Because we've been not perfusing the kidneys very well. So those of you who are getting restless, you guys have to wait for the rest of the crowd. I'm going to disable the chat section because it is very distracting and annoying. Okay. So just disable the chat for a while. It's just like, that restless crowd. So then it's going to reduce the blood pressure. So year by year, we keep checking the blood pressure. It is looking very well. And then you are going to have these problems and complications. So do not address it at the root cause, address it the sludgy level, make the rivers in you flow again freely. Otherwise, it is going to be a lot of toxin filled and it is going to create a lot more damage along with the pharmaceuticals that you are popping in. Next slide. So there are three important channels. So your body is going to clean up through these kidneys, skin, and lungs. So no matter how many medications you're going to take, is going to create more sludge in the system. It's almost like, you're going to take a river that is totally polluted in the city. And do you want to dump in more chemicals or do you want to clean up the river? The ideal thing to do is not to dump any more chemicals in the name of pharmaceuticals, but to clean up the river in the city. The same thing, clean up the rivers in the body and then let the rivers flow freely. Let the rivers be toxin free and let's just clean up, clean up, clean up. So that's what we have to be doing. So now coming to solutions, right? Everybody wants solutions, but you don't want to have a proper foundation, proper understanding of how disease is built up. How can you guys cure yourself if you don't understand how this issue has been built up? So if I meet you again or not, I don't know. But you have to understand the pristine rivers in you have been polluted, just like the city rivers in the city, and you have to clean up. The cleanup can only be done by your body, only with the right kind of inputs, but not by dumping more chemicals into the system. Next slide. So again, stages of disease, it starts with one pill, then multiple pills, then the complications of heart disease. But again, you keep popping these pills, but again and again, this issue comes in. And finally, there is going to be a transplant or something or the other that happens to us. This cycle, it has to be stopped. The only way you're going to stop this cycle is by addressing it at the root of the issue, by eating the right kind of diet, the way that we suggest at WellCure, which is very simple and it is very affordable and it can be practiced every day for the rest of our lives as well as with a proper lifestyle. Next slide. So the pills are not the solution. It's almost like stepping on the gas and the accelerator and the brakes at the same time. Along with that, you're also going to experience the side effects, just like how I explained to you about what my father-in-law has gone through, secondary to all his issues. So medications can do what a dietary and lifestyle. So medications are not going to be they can never ever replace diet and lifestyle. So we have many people who have come through us. This is Mr. Rakesh, who lives in Bombay and who has initially come to us with the high blood pressure issues. He was diagnosed with high blood pressure when he was in third grade and they told him about medications. He ran away from the hospital. So he came in with high blood pressure, cholesterol, blood thinner. He was having psoriatic arthritis. He was having uric acid issues and other anxiety. And it was just a never-ending story of more and more medications. So within 30 days, he started seeing significant improvements in his health. And now he's off of his medications. All these diagnoses have been has been erased. And now he's healthy. And the amount of healing that has happened in Rakesh is all because of the proper health guidance as well as his discipline and his self-determination to not to get into the hospital or into complications ever again. Next slide. So we have many issues
I can explain the rest of the slides. Yeah, so we have many other testimonials, guys. You can go to our YouTube channel, you can go to our Instagram, and we keep regularly posting healing journeys. So here is another person who got rid of blood pressure, cholesterol, sugar, thyroid medication, and also lost 6 kgs of weight. Yeah, so a lot of things like this. And here is Sarita. So she came to us and she did our monthly program. She wanted freedom from blood pressure, sugar, cholesterol, thyroid, and vertigo medicines. And she got back high levels of energy and reduced pain, lost 6 kgs. And she actually came back for another program also to continue her health journey. And she's doing very well without any medication. She also lost a lot of weight and she started looking much younger. So who doesn't want that, right? Freedom from blood pressure, cholesterol, thinner, psoriatic arthritis, lost 7 to 8 kgs weight. So these are all the WhatsApp messages. So I'm sure all of you would like to know, like what are the solutions, right? Many of you are asking, what should I do to start reversing my health issues? I want to go the natural way, but I don't know what to do. So here's a simple three-step action plan, which all of you can start from the comfort of your home right from today, uh, to start to basically enable your body to do what it is already designed to do. Your body already has self-healing abilities, like what Dr. Prashanti explained. So it just needs a little bit of effort from your side, instead of going towards pills and other things which you feel is a ready-made solution, but we all know that it is going to cause progression of disease and side effects. So let's go towards a natural healing reversal journey. So here are the 3 points. The first one is fruits for the win. Second one is keep active. And the third one is intermittent fasting. So let's take each one of them one by one. So, how much fruits do you all eat in a day? Can you write on the chat? How much do you take in a day? Or are you scared that fruits are going to increase your sugar levels, make you cause to gain weight, or any other things, right? So, fruits for the win. Fruits are nature's best fast food. They are the complete package which nature has given. It's full of fiber, nutrition, and the purest form of water which the body is designed to work with. It is nature's original fast food, and as I say, it is a veritable buffet which nature gives at every season. At every season, you have different fruits coming in. They are so colorful, flavorful, aromatic. Unfortunately, we've all been brainwashed to think that fruits are fatty, fruits have pesticides, fruits increase blood sugar levels, fruits cause allergies. So nothing is farther from the truth. The original food of man is fruits. So fruits need no salt, no condiments, no fats, no oats. You have to eat fruits on their own. So at least 3 servings a day you should take fruit. Fruit should not be treated as a snack. You should treat it as a meal. So Anuradha, Arundhati, you're just taking one fruit daily, which is quite less. Our body is 70% water. To maintain that balance of water in our body, we need more and more natural sources of water. And fruits are a great pick me up. You don't need any kind of work to eat fruits, right? Just peel and eat, cut and eat, whatever it is. And you have so many choices. So add fruit to your plate. Make that the first choice whenever you're in doubt. So, when to eat fruits? So, eat fruits as at least the first meal of your day. Instead of having a cooked breakfast of cereals, eggs, meats, other processed and cooked foods, packaged foods, instead shift your meal to fruits, and your body will really thank you for it. And you will also see that you will have a very effortless weight gain. Most people who join our programs make this shift very easily. This is the time, especially the morning time when the body is busy with detoxification, is the time for you to eat more fruits, right? So eating fruits, this is how you should do it. Instead of eating all those colorful junk foods, why not change to more colorful fruits from nature? Peel and eat, make smoothies, make simple porridges, or just cut and make a fruit platter. So there are so many choices, and yeah, it makes life easy for you in the kitchen too. The next step is to stay active. Our body is meant for moving. We are meant to move our body. A sedentary lifestyle Even doing just 30 minutes of exercise in the morning and sitting for the whole day without exercise is going to build up more lymphatic waste in your body. So, our lymphatic system is the waste carrying system in our body, and when the movement doesn't happen, when exercise doesn't happen, the flow of the lymphatic fluid becomes very slow, and here and there will be blockages created, and that's when you start seeing different symptoms, whether it's muscle aches and pains, whether it is joint pains or skin issues or anxiety, palpitation, loss of memory, overthinking, all these things. So, the lymphatic system needs movement and we have to stay active. So, choose anything which you like to do. Consistency is what matters. You do not need to have high intensity exercises to see improvements, you need to be consistent. So what can you do? Choose any activity which you love doing so that you will not miss a single day of exercise, whether it is doing the household chores yourself, gardening, swimming, brisk walking, yoga, anything of your choice and your love, right? If you can combine that activity with mindfulness and breathing and outdoor air, that is the best way to get better. So start doing something right from tomorrow. You will be able to make time if you make your health your priority. Your body has already been giving you many symptoms. It's time now. Don't wait for, let Dasara be over, let Diwali be over, or I'll start from New Year. The time to do is now. The third one is intermittent fasting. So, intermittent fasting basically means to give a proper gap between your meals. So, if you keep your body busy with digestion, sorry, excuse me, busy with digestion throughout the day, it's just going to get exhausted and toxins are going to accumulate in the body. So, intermittent fasting is a great way to give a rest to your digestive organs, and the body will utilize this resting period to remove waste products, and that is the way the excess cholesterol and the excess deposits in the body which are increasing your blood pressure or your sugar will be removed by the body itself, whether it is obesity, insulin resistance, high cholesterol, hypertension, inflammation, everything improves with intermittent fasting. So how do you do intermittent fasting? Intermittent fasting basically means that you restrict the time window in which you eat. So restricting the time to eat for a specific time of the day is much easier and better to do than trying to restrict your calories. So how many of you have tried, keto diets, paleo diets, or reducing the amount of food you are eating, doing calorie restriction? It never works, right? After some time, you are back to your old eating
अब ये
habits.
झरना चालतोय मारे यार
So you're back to your old eating habits, and that causes again a disturbance, right? So intermittent fasting is giving a proper gap between your meals so that the food you eat is properly digested and also the organs of your body can take some rest. So go stepwise. The most important gap should be the gap between your dinner and breakfast. So if you are someone who eats a late dinner and an early breakfast, that means you are not even giving at least a 12-hour gap between your dinner and breakfast. So start with 12 hours and then you can move to 14, 15, 16 hours. So, giving a proper gap and doing it stepwise will really help your body catch up with the arrears of toxins inside the body. So, hunger is a product of work. Today, most of us are eating even without hunger, right? So, it's just because the wall clock shows a particular time that we are putting in food inside the body. When you join a program, we teach you how to find out what is hunger, how to develop that hunger, how to eat properly, what time to eat what. All these things will be explained. So, hunger is a product of work and eat only when you are hungry. So, those are the three steps we discussed: eat fruits, plenty of fruits, move your body, and the third one is adopt intermittent fasting. So, to learn more, we will be explaining towards the end of the program. Now, over to you, Dr. Prashanti. Okay, so as the blood pressure reduces, when,
Mm-hmm.
yeah, over to you,
Yeah.
Doctor.
So those of you who are like, like, did you guys write down all the three, this one? I think you can enable the chat. Let's see, because we can't just keep it silent.
Yeah, it's
So,
enabled.
okay, so yeah, so did you guys write down all the solutions for now? So these three important solutions can be life-saving, okay? And in order to help you reduce your blood pressure as well as your cholesterol issues. So as the blood pressure is reducing, stages of reversal that we do during the program are initially the blood pressure reduces, medications we don't drop immediately. Then we will slowly, gradually taper these drugs, and then at some point we will when it is normalized, we know when to do all these things, because we are trained, very well trained to do these things. So we will do a guided program where you will be reducing and working on yourself with proper amount of education foundation, as well as diet, nutritional, as well as lifestyle support. You will be able to come out of this vicious cycle of blood pressure, more medicines, more side effects. Then this chucker, you won't be able to do any of that. And again, the side effects, again, all I'm trying to tell you is the side effects from these drugs are going to put your regular symptoms to shame. So that you are going not, or that also you're not going to be experiencing. No side effects. Aha, there are no side effects and there are no symptoms. So everything is right and settled. So, this is such a simple thing, but what is the important thing that you have to know about this are it needs a guided program. Okay, it's not like a quick gimmick like where we can tell you some tips, but it has to be a habit forming thing. So little by little, we make all these changes to a point that you this becomes your normal. This totally becomes your normal, and then you're going to keep continuing this lifestyle forever. So this is how things start, and this is how you're going to start healing yourself, and this is how you're going to get out of this chucker of medication, side effects, and more drugs. Okay. So we are going to be explaining, this program is for everybody who has, who have high blood pressure, cholesterol, or your loved ones had a heart attack, and they are going through so much, or you really saw, your father or mother go through so many health issues, and you are like, I don't want to be part of any of this. I want to know exactly what I have to do. And those of you who are really getting more and more into this, I'm really tired and sick of these pharmaceuticals. What do I do? Any of you can come into this with side effects of the drugs, with who are going through lot of anxiety, palpitations, panic attacks, indigestion, acidity, bloating that is raising your blood pressure. All of you are going to get benefited from this program. Pretty much everybody who is here with high triglycerides, high cholesterol, low blood pressure, high blood pressure, it's it's all about acidity, toxicity in the system. It's all about pollution in the body. Remember, the rivers in us have been polluted, and it is time we clean up the rivers with the right inputs. All right. Anything else, Asha?
Yeah. So thank you, Dr. Prashanti. We are going to explain the upcoming program we have on improving your heart health, correcting your BP and cholesterol. So this program is going to be a 1 month program. It's called the Healthy Heart Challenge Program, BP and Cholesterol Correction. It starts next Monday and it runs for 1 month, 14th October to 9th November. It is going to be conducted by Dr. Prashanti and myself. It's a group coaching program. That means those of you who are interested in the program can join us, and we help you as a group. You all work together with diet and lifestyle corrections, and you start seeing improvements in your blood pressure, your energy levels, your weight, and reduction of cholesterol. So, what are we going to give you in this program is there will be weekly diet plans. So, don't worry, it's not going to be a deprivation diet, lot of delicious recipes, simple recipes which you can do. We are not going to ask you to order any kind of superfoods, any supplements. It's all going to be your simple, normal foods, but how can you tweak them to make them better? And we'll help you along this path with diet plans. We give you guidance on lifestyle and natural therapies. So what do I do at the end of the day if I have a headache, if I have a migraine, I'm having a lot of acidity and gastric trouble, my BP goes up high? So what therapies can I use? Instead of popping in medicines, we use the power of sunlight and water and other things. Through breath work we help you manage this. Then we will also give you a recipe book on heart healthy recipes, free ebook on exercise and cardiovascular health. So a lot of freebies coming your way. Plus, this entire program will be conducted on Zoom and WhatsApp. So there will be 3 Zoom sessions, one at the beginning of the program, that is next Monday at 6:30 p.m., then one after 15 days, and one at the end of the month. So every session is recorded and given to you. You have access to one whole year. So even if you miss a session, you can always watch back the recordings. And both Dr. Prashanti and myself, we will be available with all of you for the entire duration of 1 month, answering your questions, giving you recipes, helping you make changes. And Dr. Prashanti will be there to help you reduce your medications and guide you on the path to total health. So, we use the modality of nature cure, which is a powerful method of healthcare using the 5 natural elements of sun, air, water, earth, fire, and soil, right? So, this is how we help you heal. And this is a program with no side effects. The only side effects will be your return to health and getting off your dependency on medications. So these are the details of the program. So we have one session on 14th October where we will be talking to you about setting the base, how does natural healing work. So what we are aiming is at the end of 1 month, you'll be fully empowered, have the confidence and the knowledge to know how your body works, something which you never got from the medical industry, right? So this will give you the confidence to stay on the path lifelong. So whether you have only blood pressure, cholesterol, or whether you have heart issues also, whether you have diabetes, whether you have thyroid, every problem will get corrected. So as Dr. Prashanti explained, the body heals as a whole. So you have the additional bonus of healing from other diseases also if you join this program. Then live session 2 will be talking to you more about therapies, and every session will be ending with a Q&A. And yeah, so the third session we tell you how you can continue this journey for lifelong. How can you track your progress? How do you know your body is healing? So it's a wonderful program. Not only will you be improving your own health, but the health of your family members, your children, everything can be improved because you'll be leaving with a lot of education, right? Yeah, so we have a special Diwali Bonanza offer. We are also giving you a guilt-free festive ebook, How to Make Diwali Healthy. So this is a free ebook given to you with different kinds of healthy Diwali food without all that excess fats and artery clogging ingredients, right? So yeah, so this is also going to be given as a bonus. We also offer you one-on-one personal coaching. If you don't want a group coaching program, instead you want a one-on-one personal coaching program with Dr. Prashanti and myself, you can opt for that also. So this will give you more an opportunity for you to get in touch with us at a deeper level, and we'll be able to guide you more. So what will happen in the personal coaching? We take a detailed case history, we give you a personalized approach and plan, and we help you make customized guidance for diet and lifestyle management. So, if you are on a lot of medications, you have a complicated health history, we would advise you to join our personalized coaching program instead of the group coaching program. Even in the group coaching program, we will be circulating a form asking you to fill up your current lifestyle, what medicines you are on, and help you change it. And even in the personalized coaching program, we get into it at a deeper level, especially if you're on a lot of medications. So it's a holistic approach. Both programs follow a holistic approach of mind, body, and spirit healing. We do not prescribe unnecessary diagnostics, no superfoods. We are not selling you any remedies or any kind of artificial pills or supplements. It's all going to be based on the principles of nature cure. All that we are doing is helping you make some changes due to which your body, which already has the self healing capability, will start taking on that and start showing results. So hundreds of people have been through our batches on blood pressure and lifestyle, on blood pressure and cholesterol correction, fatty liver, diabetes reversal, autoimmune diseases, and many such programs. Okay, so these are the details. So if you want personalized consultation, this is we have a 1 month and a 3 month coaching available. These are the cost. It is at a discount right now. If you sign up by today, you get a discount. So we offer everything is going to be online with personalized video consultation. We get your medical reports and we understand your diet and lifestyle, and we give you customized diet plan and WhatsApp support. So the group coaching program is priced at 2000 rupees. That is also at a discount currently of 500 rupees. So these are the details. Offer is valid only till tomorrow morning at 10 a.m. So, whether you want to join the group coaching program or the personalized coaching program, all the details are here on the screen. So, you can scan the code from your phone, it will take you to the website where you can make the payments. So, please do take care of your health the natural way, uh, right? So, your body is already designed to heal, and you just need a little bit of guidance on that path. Okay, so we are going to leave this slide here for you to check it out. But if you have any questions, we are glad to answer your questions. So Kaumadi is asking, do these tips work at any age? Yes, of course. As long as we live, we have the self-healing ability in our body, right? Except that it depends on, it's not really the biological age, it depends on how many medicines, how much you have abused your body. So that may result in taking little more time, but everyone can heal. We've helped even 80-year-olds get off medication. You can see all the testimonials on our YouTube channel. An apple a day, Barkha, is not enough. An apple a day is a snack. So we said eat fruit like a meal, right? What is genetic cholesterol? Can it be healed without medicine? I mean, it's just a name given. There is nothing genetic about that. Genetic in the sense, yes, you may also get cholesterol if you follow the same eating and living habits as your parents. So, if they had similar kind of lifestyle and landed with heart issues and cholesterol, and you follow the same lifestyle habits, then you will also be getting the same thing. But genes are not the determinants of our fate. If you change your lifestyle, even genetic conditions, so called inherited conditions, can also be reversed. Like in my family, my father's side, everyone is diabetic, right? But I am not. So the only reason is because I decided to change my lifestyle and follow nature's rules. So it's all in your hands. Arun says 6:30 p.m. is not able to attend, but that is the time when most people get free from work. So if you're not able to attend, you can always watch the recordings and then ask us questions on WhatsApp. So we will be around to answer all your questions. Ashleka has shared the details of the program. So you can book it through Razorpay or through GPay. The number is here. So, Pankaj, I'm sure you are not working for free for your company, right? So, why not support a company which is working uh, for health using the principles of natural healing, right? I'm sure it's unreasonable to expect anybody to work for free. We have given you this entire, a cardiologist from US is spending 1.5 hours of her time talking to you all for free. You are under no obligation to sign up, but I think it's unreasonable to ask for a completely free program. So you have to value other people's effort and time, and that's how you get health, right?
So, yeah. Yeah, then, yeah, there are many free resources. You can make use of them. But again, don't be dope, like, don't be penny wise when it comes to your health. That's no health for all that. So if you have any more questions, let us know. So Suresh is asking about pre-diabetes. Yes, it is one shop stop for everything. And Harsha is also saying fatty liver. Yes, Harsha, it is fatty liver as well as for blood pressure. See, it's all about toxicity. The rivers in you are polluted. So you clean up, and then all the organs are also going to, catch a fresh breath of air, and that's how you're going to heal yourself. Uric acid too. Hey, uric acid, thyroid, just like Rakesh. Like, I just showed you Mr. Rakesh from Mumbai, right? So it's everybody is going to get the benefit of this program. Uric acid, thyroid, all of you, acidity, gut issues, everybody will start seeing improvements because, again, remember, your uric acid problems are related to your cholesterol, are related to your thyroid, is related to your blood pressure, is related to your heart disease. Everything in the body is interconnected. It's all intertwined.
So Poonam is asking, will the medicine be stopped after doing the course for high BP? So it will be tapered off during the course itself, provided you follow the guidelines we give. So
And
as you keep measuring your blood pressure, it
mhm.
will indicate that you are getting better, and Dr. Prashanti will help you do that.
And you will be regular with all the logs and everything. As long as you follow, everything is going to improve. It's very simple step by step approach, and it is very well done.
Harsha is asking, can I get the bank details? I can't GPay, I will pay tomorrow morning. Yes, I think Ashleka has put up the details. Ashleka, you can share it again if you have the bank details. So you can go to our website and learn more about us. We have a lot of free blogs, so you can understand what the principle is about this kind of healing. So maybe some of you are still skeptical. Is it so easy to reverse all these things? Probably you've been told by authority figures that this is for lifelong. You have to take these medicines lifelong. It is genetic. Those kind of things which have gotten into your mind. But nature or Mother Nature has all the solutions.
તમારી પર કોઈ પ્લાનિંગ છે હું મરી ગયો ધારો કાલે મેસેજ આવ્યો તમે ભૂલ ગયા પછી
How is it,
તમારો મોટો બાપુ
Ashleka,
ભૂલ
that somebody is
અરે
able
કોરોના
to?
એક્સપાયર થઈ ગયું તમે
Can you
તમારું શું
please
હશે
share?
કામ
So some of you are asking, so
Talking.
Ramana is asking, can this be in Telugu language? See, Ramana garu, నేను తెలుగు మామూలుగా మాట్లాడతాను, నేను తెలుగు అమ్మాయిని. సో మీకు ఇది ప్రోగ్రామ్ ఇస్ గోయింగ్ టు ఫర్ ఇంగ్లీష్ లోనే ఉంటుంది, ఎందుకంటే చాలా మంది ఉన్నారు కాబట్టి. కానీ మీకు 1-on-1 కానీ ఏదైనా కావాలి తెలుగులో మాట్లాడాలంటే నేను తెలుగులో మాట్లాడతా. సో మీ ఇట్స్ అప్ టు యూ వాట్ యూ వాంట్ టు డూ, బట్ తెలుగు ప్రోగ్రామ్ ఇస్ నాట్ దేర్ for group coaching, but we Asha speaks fluent Kannada, I speak Telugu. हम दोनों हिंदी में भी अच्छी तरह से बात कर सकते हैं आपको. So अगर आप चाहे तो हिंदी में भी कर सकते हैं इसको, लेकिन 1-on-1 लेना पड़ेगा, लेकिन ग्रुप कोचिंग हिंदी I mean इंग्लिश में ही होगा. So yeah, I think Amit is saying
My
starting.
mother, uh,
Mhm.
1 year back, she joined this program because obviously she was not listening to me, just like our family members. But she joined this program and she saw that how other people were healing in the group, and she also followed the guidelines, and she was able to reverse her blood pressure medication which she was taking for many many years, including statins. So yes, Amit, the answer to you is yes, statins are not necessary if you follow the lifestyle properly, right? Like as Dr. Prashanti explained, statins and all that is going to cause long term problems, muscle weakness, brain fog, and other issues. Yes, it is possible, as Jane, that immunizations have a role to play. Yes, you can pay tomorrow. So Ashleka has shared the bank account details. Please copy it. Malini is asking, will I learn anything more than what I learned in the 3 week certification course? Are you talking about the HNR course? So probably this course will give you more details on how to actually implement it. Yes, blood thinners also can be stopped if you follow the program properly, right? Blood thinners, beta blockers, whatever be the mode of the blood pressure medication, they are all different ways in which they are reducing the blood pressure artificially. So they are going against what the body is trying to do, which results in many harmful effects, right? So that's why people experience palpitations, lightheadedness, unable to sleep, anxiety. All these are the side effects of medications which are reducing the blood pressure artificially. Okay, so Ashleka, can we play that video now? So we would really invite you to just stay on for the next 5 minutes and watch how Anu was able to reverse her blood pressure and skin issues. So Ashleka, you have that video ready?
Yes, just give me a minute.
Okay, I'm going to play it myself.
51st birthday, I was desperately looking for help. My high blood pressure was out of control, and I was also suffering from some pain or infection all the time. I was on 4 to 6 different medicines, and I was literally going to a doctor every 15 days for one problem or another. Fast forward now, 3 months later, I have zero medicines and zero doctor visits. Hello, everybody, and namaste. I'm Anuradha. I'm a wife, mother, and an IT manager in Michigan, USA. I suffered from high blood pressure and cholesterol from more than 15 years. Every year my medicines were increased, but I was not feeling or getting any better. And last year I was even hospitalized 4 times. Not only this, I was overweight, tired, and I had constant pain in my arms, legs, neck, and shoulders. I was also frequently catching infections like sore throat, UTI, and had swollen glands. I had shortness of breath climbing stairs just to even go upstairs in my own house. I really had lost all hope that I could ever feel normal again. But luckily, my
Okay, guys, so that was Anu. So it was a wonderful testimonial. So thank you all for attending today's session. Would you like to say any closing remarks?
Yeah. No, it's all in your hands. I think we are down to only 53 people. So these 53 people are the winners at this point, I guess, because restlessness is going to give us any kind of health benefits or any of, okay? So again, work on yourself, but do not blindly pop in a medication because it's not the solution. You have to work on what is going on into your body, and it's very simple and it is very effective and it works 100% of the time. So it's all in your hands, and we are here to help you. But just as since you guys are all new to Wellcure, just explore the website, follow all the testimonials, read up all the blog posts, and then make up your mind. See, nobody is putting a gun to your head. And listen, if you don't want to pay money, that's fine also, but do not poison yourself just because you thought 2,000 or 5,000 rupees was too much for you in order to take care of your health. Do not do that. Do not do that. But take care of your health, and everything is for free over there on Wellcure website. So get started somewhere. And we told you what we have to do. So this is like, we are washing off of our karma at this point by telling you the truth. And you do what you have to do. It's all in your hands at this point. So give the number for inquiry like Telugu language person. I don't know what that means, but then
Yeah,
Lovely.
Ashlika has shared it.
Okay, Lovely has question about personal coaching. So somebody will get in touch with you. And some people are asking about bank details as they don't have GPay. So,
Yeah, it has been shared.
okay, so everything has been shared, everything has been addressed. So it was nice meeting you guys. So remember, the river sinners are polluted. So you guys have to clean up the rivers, okay? So no amount of chemical dumping is going to clean up the rivers, but it's all in your hands not to pollute it anymore. And remember, body is always self-cleaning, self-healing, and the power that has created you is going to do all that. And yeah, it's very important that you stay on track with all this, okay? All right, guys, take care.
Take care, everyone.